we'd like to welcome you to this Advanced Health session. This is actually, we worked out this week, the 18th edition of Advanced Health that we've done to date. And we're, as I've said, thrilled to be back here. We are bringing you this session with our usual partners, obviously Dubai Science Park, Connect Communications and Synapse Medical. And today we're going to be talking about, the headline topic is Beyond Paralysis, and we're going to look at critical issues that are paramount to managing the life post-diagnosis and also the treatment journey along the way. So we've got 4 wonderful speakers here covering the whole spectrum across that topic. So without any further ado, I'd like to introduce the first speaker, Dr. Niels Heberland, who's a consultant neurosurgeon at Neurospinal Hospital. So Dr. Niels, if you'd like to come up.
Today I want to speak about new treatments for traumatic spinal cord injury patients, the future treatments, and we think this is really a revolution in medicine, what we can do for these patients. In this year we are planning to start in the Neurospinal Hospital with a scientific study, phase 1, for spinal cord injury patients, for the traumatic, for the chronic spinal cord injury patients, and for the subacute. We will do this scientific study together with a European company. They have a lot of experience in this field. This is Neuropilates, located in Netherlands, in Maastricht. Our mission is to help this kind of patients who are paralyzed due to a spinal cord injury, because nowadays, of course, we can do a lot of things for such kind of patients. First of all, high-tech surgery to make a stabilization of the traumatic spine and to make a decompression of the nerve structures and of the spinal cord. And of course we have also a lot of possibilities for rehabilitation, and these possibilities nowadays very advanced. But in the end we cannot achieve, especially for complete spinal cord injury patients, an improvement in the neurological deficit. This is nowadays not possible. That's why we are looking for other treatments. This is the scientific board of this company, Neuropilates, and the team. You see, the scientific board is very international, from all over the world. Neurologists, neuroscientists, psychopharmacists, and even one neurosurgeon, this I am, working together to make this kind of scientific studies possible and to provide the patient this treatment. On the other hand, they have a very good biologist, Dr. Eckhard Lang. He has more than 30 years experience in cell culturing, cell characterization, isolation techniques, and GMP production. And so he developed the preparation of stem cells and the things. When we are talking about stem cell treatment for spinal cord injury patients, our strategy is to take autologous stem cells because these autologous stem cells, they have normally no side effects for the patients. And we will take these stem cells from the bone marrow material. This is an easy puncture of the posterior iliac crest, and so we can take enough material for the laboratory preparation. Then In Maastricht, they have an excellent stem cell laboratory, and they're working under the system of good manufacturing practice in clean rooms, and so in the end the quality of the stem cells are very, very high. Neuroblasts, they have already the proof of principle for spinal cord injury, for the amyotrophic lateral sclerosis, and for the frontotemporal dementia. And even they have the approval from the European Medicine Agency. This is like the FDA in US, but this is now for Europe, to perform scientific studies for the spinal cord injury. Because nowadays the autologous stem cells, it's under the law of medicines, and that's why you need this kind of approvals. And they have also a patent in US, the methods for reducing the inflammatory activity for stem cells transplant. This they are doing with antibodies. This is a procedure, what we are doing in the study. Of course, the first step is then the collection of the bone marrow material, like I explained, and then the transportation to the laboratory in Netherlands. Over there, they're starting with the production, with a procedure to removal the erythrocytes and reactive proteins. The step 3, it's very important, removal of the lymphocytes and pro-inflammatory proteins. This they do with a patent procedure with antibodies. And then, last not least, the concentration of the stem cells and the characterization of the stem cells, including the hygiene. It should be absolutely sterile, and then they can release the stem cell product as a medicine. And last not least, the treatment step is to re-inject the stem cells. You see this in the right picture, via lumbar puncture into the cerebrospinal fluid. And then the stem cells have the ability to migrate to the lesion in the spinal cord. Also other possibilities for the application. We know this from former clinical trials, which were very successful, especially in spinal cord injury patients. You can use also an intrathecal catheter to inject the stem cells direct to the lesion. For the brain, you can use stereotactic navigated techniques to inject, for instance, the stem cells direct to the brain lesion. Or for the spinal cord, you can also use a microsurgical procedure to open the dura and to inject subarachnoidal the stem cells. So nowadays there are different ways for the application. Of course, the easiest way and very safe is via lumbar puncture. That's why we chosen this now for this scientific study. The phase 1 study, the aim of the study is to see how safe the stem cell product inside the human body. We want to see and to figure out if there are any side effects or not. So we started then with a chronic traumatic spinal cord injury in the phase 1, and the phase 2 and phase 3 will then with a subacute spinal cord injury. And if we inject the stem cells immediately after the accident and after the injury, then the effect and the results, of course, much better, because then we are not facing with other problems like the scar inside the spinal cord, what's coming later on. So the design of the study is a multi-center study. It's already started in Spain, in Toledo, with the chronic spinal cord injury patients. Until now, they not discover side effects, and they have amazing improvement, even in this group of the chronic spinal cord injury patients, with improvement in the motor function, in the sensory function, and even in bladder and bowel function. This is really very promising, the first results. Then we have another hospital in Germany, a trauma hospital, a huge trauma hospital in Germany, in Halle. They will join, and even a hospital in Denmark and Copenhagen, and last not least, in this year, our hospital, the Neurospinal Hospital, will start with this phase 1 study. Later on, of course, then the phase 2 and phase 3 study to take the official approval from the European Medicines Agency, and hopefully even here from the DHA. This is the open label study. We will involve maximum 15 patients. The age, of course, they're adult patients, they're young patients from 18 to 40 years. And the treatment period should be 1 until 3 years after the accident. Again, what we are doing with this study, primary objective, characterization and confirm the safety of the intrathecal administration of neurocells, that means stem cells. Then we will see the patient in the follow-up for the clinical neurological examination, and even for the laboratory tests after 3 months, and later on after 12 months. We will check in this study the motor function and the sensory function of the patient according the American ASIA classification after the intrathecal application. And of course, we will record also other function like autonomic function and the daily activities, the pain perception, and the reducing of the pain, and such things. In summary, we can say this is the right step, and this is the future to treat paralyzed patients. And the next steps will be then for other patients, for instance for brain injury. It's working very well for brain injury, for stroke, and especially the former clinical trials showed the best results for cerebral palsy patients. That means for the kids in this group, we had the best results. And so if this study will be successful, and we started the stem cell treatment as a treatment with a medicine here, with the approved medicine here, then we will established here in Dubai, in the Neurospinal Hospital, the second laboratory, like in Netherlands, for the stem cell treatment and for the stem cell preparation. This is our vision, and on this we are working very hard. Thank you very much.
Hi. First of all, I'm not paralyzed. I think that's the first thing that I need to say because the event is beyond paralysis. And as a person with disability, I feel like I need to define myself. And when I was invited for the event, I was discussing with the team, but I'm not paralyzed. How can I speak for people with the paralysis? I feel somehow unfair. But then I was thinking about it, what shall I emphasize from my journey? The main thing I would say that's very much in common between me and a person who might be paralyzed is that awareness. It's amazing, I appreciate healthcare service, the doctors, the professors, the team, we can't survive without you guys. But at the same time, the society, and let's speak about the Middle East society because that's where I come from. So I wasn't born as an amputee, I had things happening. And the reason for my amputation is that where I come from. I'm from Iraq, Baghdad, a war zone country. And when I was born in the year of 1990, actually by then there was only a minor war. However, when we moved to our house, there was a leftover. But because of the sanction and the things that the society is used to, so if I found something useful, I should keep it. It could be helpful one day. And this bomb actually didn't look like a bomb, it just looked something metallic. So we thought we can use it. Fix things around, and there were workers fixing the house, and we thought yay, this is a good thing to keep. I was born in the year of 1990 when my family moved to this house, and this thing stayed in our house for 7 years. And different people used it actually, but nothing happened. So moving forward, I'm taking you here in a history class. Moving forward in years, in 1997, I was fixing my bicycle with my father and youngest sister, and we used it. My dad stepped with the car on the handlebar of the bicycle one day, so I wasn't able to ride my bicycle properly, and I insisted on that day that please fix it for me. We used it, and we gave it the right friction with the hammer, and guess what happened? It exploded. And that was a life-changing moment for the three of us. I lost my leg, obviously, but I didn't lose it right away. It was badly traumatized, and then in the second hospital, the doctor didn't do the right decision, so he kept a cast, and that led to a gangrene. It was a wrong timing. And they discovered in the third hospital, which was kind of too late. So my mom and my uncles had to take the decision for my father because he was in the ICU. My dad lost his hand right away, and he was badly smashed. Luckily, nothing happened to his head. But he went through a lot. He had a very long journey, rehabilitation, surgeries, fixing his bones. And I can't imagine the trauma that he lived in his whole life until this moment because of this accident. Especially we're speaking about the Middle Eastern man who never expresses emotions, and he has to be the man. And seeing his daughter, his female daughter, growing up in the Middle Eastern society is an amazing thing, the society would keep me in a box, and because I'm a female, hey, you're broken, So growing up, my youngest sister, luckily, alhamdulillah, she had minor issues, but by minor, I mean she needed cosmetic surgeries, she had a lot of things in her thigh, fixed her knee, but that's considered minor, So when I was growing up, that's when I realized we live in the Middle East, okay? And that this problem actually is not only in the Middle East, but I speak for the Middle East because this is where I grew up. However, it exists all over the world, which is awareness. And when I saw Stuck movie, which is related to the campaign Beyond Paralysis, this was something great to see because I grew up and I didn't see such movements happening. So being a teenager, going to school, and going back home, I didn't really interact much with the society. But when I got into college, that's when I realized I am really an amputee. From the year of 7 years old until I was 18, I didn't really feel it much. I was somehow being included with the neighborhood playing, running with one leg, jogging and hitting people with my crutches, to interact. That's how kids interact. I didn't feel much that I was an amputee. But when I got into college and I had an identical cosmetic part, not this fancy leg, I had a very basic leg band then, and I had a cosmetic part that, they designed it based on my leg, so you wouldn't differentiate. You would see me limping, so you would assume, okay, maybe she has something with her hip. And by then, when people would approach me like, hey, can we ask you what's wrong? Why you're walking this way? I'm like, I'm an amputee. And they're like, what does that mean? I have a prosthetic leg. What does that mean? So that question, the accumulation of that question, one after the other, ended up somehow like a slap on my face. I'm like, wow, people really don't know. And what made it worse is that once they know somehow what it means, they put me in a box that maybe I'm unable to participate in certain events with heavy duty, or they would help me out in carrying things, but I can't carry it. They would maybe even click the elevator for me. My hand is working. So things start to change. So the university was a turning point, and close to the year of graduation, there was an event, and they asked me, like, why can't you become a speaker and share your story? I'm like, okay, this happens? Like, people can share their story? Really? And I did. I was terrified on that day. I was just a student. I had no idea what to say, what would my family accept I can share, and what I want to share, and what could affect me and what not, and so on. Because you can't just show up and freedom of speech. It doesn't happen here. And then I realized the effects, the influence, how people started to understand. And when I shared photos, it even made things easier. And still, I had a cosmetic part. They still can't see my actual leg. And during these years, I did my research. And I realized that this cosmetic part is just an optional part. And I felt so sad when I knew this. I'm like, as a child, as a teenager, I had no awareness about all, the functions of my leg. My mom would just take me to the doctor, fit it, and that's it, we're back home. I'm like, wow, my dad had to pay all these years for an extra part, and he's raising 4 children, and he had a lot of expenses just for me to cover up from the society. I felt so mad. And close to my graduation, or when I did graduate, one day I was invited randomly to the university to have feedback from people with disability, how to improve their college and so on. And I didn't want to attend, to be honest. And I just showed up because they're calling me, all right, I'll just show up. And I just graduated. I had no idea there were VIP attending the events. And I was sad for how people were sharing their stories on the stage. I'm like, this doesn't represent me. Don't say it in a pity way. So when I stood up and I spoke, I'm like, I tell my story, but not the same way. So this is my story. And then I was invited to be a keynote opening speaker for Al-Amal Camp, which is in Sharjah, for Sharjah Humanitarian Services over there, led by Her Highness Sheikha Jamila, the daughter of Sheikh Qasimi, Sharjah Rural. And she asked me, she said, listen, the same way you showed up, I want you to be that person. So I felt so scared. And at the same time, I asked her, can I do something that I have always wanted to do on the day of the opening ceremony? And she's like, okay, what do you want to do? I'm like, can you trust me? She said, okay, go ahead. And before one day, I went to my doctor, and I'm like, take off the cosmetic part, please. And I didn't tell my parents. And I threw it in the trunk. And I'm like, I'm done. And before facing my family, I went to the mall on Friday. Because am I really strong? Can I take all the observations and reactions, families, guys, girls, kids? How will I interact with this? I was okay. I wasn't damaged as it might be perceived by my parents. I was really okay. And actually, I was not annoyed by the questions or the pointings of the children. It was more than fine. okay, some people try to help extra. But I'm like, if they will not see me on daily basis, part of their life, from far away, they will not get used to me. So now you guys, you see me at the first time, you notice my leg. But once you see me the second time, you might still see it. But the third time, you will only notice Zainab. That's it. I'm off the category of as an amputee, people with disability. You will see me. And because in my life, many people I know from people with disabilities would hide. So when I'm in the society, I'm an awkward person. How shall we categorize her, her abilities, her strength, and so on? So long story short, because I can see I've been beyond 10 minutes, it was very challenging to face my parents when I got back home. My dad was the hardest person because I believe he felt guilty for so many years, and I never saw the accident as his mistake. It's a destiny. So taking off the cosmetic part was a reminder for him whenever he's out with me, seeing everyone looking at me. It was too much trauma for him, and my mom as well. But later on, I did a TEDx talk, and I invited them and my friends who thought I'm insane and I'm like being too much, because I wanted them to listen. This is what I want to deliver to the society. The more you see it, the more you stop seeing it. And the more you bring awareness, which I needed when I was growing up. And if I do nothing about it, there is a little Zainab across the world might go through the same cycle and to be repeated over and over again. And I want those parents who feel shy or embarrassed because of people with disability like their kids, and they keep them home, to think twice. Because I know many who choose to keep their kids at home or like in a very safe zone because like, oh, he's gonna do embarrassing things, or this is too much, or it's not part of my class. So yeah, that journey took me and through so many things, and it made me where I am today, I would say. Thank you so much.
My name is Mohammed Al-Quda. I am the assistant GM for Arjo. Indeed, just to give you a brief about Arjo. At Arjo, we create innovative medical solution that helps people to maintain and regain their mobility. The next slides will give you a brief about Arjo.
With over 60 years' experience caring for patients, residents, and healthcare professionals, as the mobility experts, we're committed to shape a better future where healthcare professionals are empowered to drive healthier outcomes for their business and for the countless people who depend on them. People are made to move. Through the right equipment, environment, and skills, we offer the ability and confidence to always deliver quality care, today and tomorrow. This is our focus, our cause. Arjo, empowering movement.
Indeed, empowering movement is our brand, and just to encourage the people, those people with reduced mobility. Just to give you more details about our, you can say, company. At Arjo, we leverage over 60 years of experience and expertise to create solutions that improve quality of care for residents in healthcare and contribute a higher work satisfaction for caregiver. Arjo, a multinational company located in Malmö, Sweden, founded in 1957 with almost 6,000 employees across 100 countries. We ensure value by preventing a mobility-acquired condition, aiding the return to mobility, eliminating work-related injuries, improving cost and efficiency, elevating quality of care. So we are addressing the quality and the environment. So we are providing a solution for those with mobility challenges. A unique offering and product and services. Our equipment is designed to reduce risk of work-related injuries and prevent a mobility-acquired condition. You can look about the 8 category which we are providing as a solution, starting with patient handling like lifter, standing aid, passive solution like ceiling and floor lifters, pressure injury prevention, which means medical grade mattresses in ICU, CCU, medical and surgical ward. Medical also beds encompasses CCU, ICU, surgical and medical wards. In addition to that, we are also providing a unique solution which is called intermittent pneumatic compression, which is the mechanical part to avoid or to prevent thrombosis or clot to happen. In addition to that, we are providing a unique solution which is hygiene and wellnesses, encompasses of showering and bathing system. Also diagnostic, which is one of state-of-art solution, vascular and treatment and patient monitoring. Also flusher disinfector, sluice room, and in addition to that, we are providing 2 more services, which is clinical consultancy system and the program and after-sale service for solution. Just to come to the main solution that we are providing, we are empowering movement towards better quality of care, which we mentioned earlier, by providing a unique and state-of-art solution. As you know, ICU is crowded, and even latest event like COVID-19 give an alarm that healthcare needs more and more to invest. So here, one of the state-of-art solutions that enable those patients with a mobility to stand inside ICU, and it is called early mobility. And imagine how much this will relevant to the patient, dignified care, and relevant to the cost and long-term care. This is kind of solution that we are providing. And this slide showing the support inside the bed. We called it in-bed mobilization and out-of-bed mobilization, where the patient is connected to life-saving machine. And you can recognize from this slide that there is only one single caregiver, and it matters. In a crowded ICU, you cannot bring all the stuff to treat one single patient, and this matter for those which is working in the hospital. So with this solution, we kept in mind that only you need one caregiver to provide and to give a dignified care for those patients. Today, as a healthcare provider, I am expert, but I don't need to be a patient next day because of musculoskeletal disorder. Handling the patient, monitoring the rehabilitation for those patients is really a risk also for those which is working as a nurse staff or even biomedical engineer. And this also affects the reputation of the healthcare facility by providing a dignified care for the patient. Different segment and different support for those patients in different aspects. Here in seated position to provide a safe position considering the principle of good seating both for patient and healthcare provider. Just to drag your attention here, the second nurses is monitoring other devices. In our concept or in our dignified or in our solution, only one nurse recommended to drag the rehabilitation of patient and his mission. Another aspect, while patient is moving out of the bed, stepping, the first step, and moving to walking and stepping, it's really a big challenge for healthcare provider and the patient themselves. So we are providing a very state-of-art solution which kept in mind the environment and providing a safe environment for both healthcare provider and patient, which really impact positively to the reputation of healthcare institute and really reduce the cost on long-term aspect. This is also giving and showing the engagement of those patients and how much it really impact positively for those patients which they engage with the mobility and rehabilitation. You can see that the engagement, one-to-one eye, or eye-to-eye contact, they call it in medical terminology, eye-to-eye contact, it gives the healthcare provider the assessment of the patient. In addition to that, it improves the psychology and mental behavior of those facing such challenges. Confidence for both, as mentioned, for patient and caregiver during the safe exercise session, freeing up hands to facilitate movement pattern, and this is by neurophysiotherapy nurses. You can see from this picture one of state-of-art perspective that we design in our solution, eye-to-eye contact. If this patient is on a wheelchair, the nurse cannot recognize what the patient is suffering. The patient will fall down, faint down, what's his expression. In this solution, you can see the eye-to-eye contact, engagement of the patient, improving the psychology and improving the mental behavior of the patient. In addition, that the nurse staff will be also providing a dignified care and assessing the patient in a proper way. Transferring, moving the patient, empowering and taking the responsibility of each patient and healthcare provider is our mission. In the next slide, showing a comparison between the standard and a professional patient lifting. You can see in the first image or in the right side that the nurse with the time will be the next patient, because today she is handling the patient, tomorrow she is sick because of the back injury, so she will be the next patient. So handling paralyzed or those patients which is suffering from mobility challenges is really a big challenge. Here the nurse is just doing a monitoring for those patients which suffering from paralyzed or mobility challenges. This is showing when the challenge is increased. Here in this video, you can see that the nurse is really doing her job easily with a smile face rather than a stress, and she will be the next patient in the coming period or in long term. Next, also showing during gait and balance training, which is one of the challenge for the healthcare provider and the patient themselves for fall prevention and related costs in case the patient fall and get injured, which cost both the patient and healthcare institute and healthcare provider a lot of challenges and burden. In addition to that, we are providing a unique solution, which is assisted bath and showering. As a patient, I deserve to be hygienic during my stay inside the ICU or CCU or inside or during the rehabilitation period. We are providing showering and bathing solution. We are empowering movement toward eliminating work-related injuries. As a statistics, 50 to 60% of healthcare provider in rehabilitation or physiotherapy or occupational therapy, they are suffering from musculoskeletal disorder. When we are talking about musculoskeletal disorder, it means that those healthcare provider will will suffer and will take cost to treat themselves and will take sick leave, and this means that we are losing a qualified people in the healthcare. Improved cost and efficiency, which we mentioned that according even to WHO, that increasing the demand from healthcare and increasing the cost investing on mobility challenges. As Arju, we are also, in addition to our solution, we are providing consultant program, which really, as per the feedback from different facility, over than 100 facility, that improves and reduce patient-related injuries, in addition to the healthcare provider by 78%. We have successfully helped healthcare professional and patient facing paralysis to make remarkable recoveries after a life-changing condition. Thank you.
My name is Heba. I'm the co-founder of Body Hack Fitness Education and the creator of the Neuropilates method. So I just wanted to share with you a little bit about what we do. So basically, my company, we certify people to become fitness professionals. And you're probably wondering why I'm here talking. If we're in the fitness side of things, we believe that we have a very big responsibility when it comes to paralysis and stroke rehab in particular. We work with a lot of stroke patients. And basically, we see people on usually a very regular basis, 3-4 times a week. So we have a big responsibility to make change. So although we certify others to become instructors, personal trainers, Pilates instructors, our focus is primarily brain health in mind. And we are, our signature course is called Neuropilates, which is applied neuroanatomy as it applies to the traditional Pilates repertoire. And what we do is we're running Neuropilates classes at my core studio, which is going to be opening in the building across. And basically, we certify the instructors to have an in-depth knowledge on neuroanatomy and how we can really make change, how we can help the medical practitioner with the active side of rehab. We really emphasize our scope of practice and what we're able and not able to do, but working alongside the medical practitioner and helping people from all walks of life, anybody with a brain, to be able to benefit. And this is what we do. We focus on making people better survivors. At the end of the day, as we know, this is the number one thing and only thing the brain cares about, by building trust between the brain and the body. And we teach our instructors how to do that. In terms of the how, these are the things that we focus on. My background personally, I'm half Egyptian, half Spanish. I studied in the UK sports science, and then I went to Phoenix, Arizona, studied with Sea Health Performance, which is applied neuroscience for sports performance. And then I studied with the Carrick Institute with Dr. David Clark, and basically took all that information and applied it to the Pilates teacher trainings that I was already doing and the fitness certifications. And we focus on improving sensory input for everybody who's got any deficit. It doesn't necessarily have to be someone suffering from stroke rehab. We focus on visual and vestibular inputs. We focus on stimulating different parts of the brain, although we know that the brain works fully in almost everything that we do. We theme our classes to different parts of the brain as a tribute almost to the cerebellum or to the brainstem and what it does. And this way, as people keep coming to the classes, they start to learn a little bit more about neuroscience, how fascinating it is, and how you can do lots of little things in your day-to-day activities that can keep your brain fueled and activated, which is what we all need to be doing. We do a lot of breath practice, as most fitness professionals do. And what's not listed on here is we do a lot of graded motor imagery, which is visualizations for those who are unable to move a body part, even if it's just frozen shoulder. Can the instructor actually guide this person to visualize really their arm moving in a multi-directional way. And we do also mirror therapy, not with the mirror box, with a huge mirror, and just get them to try and stimulate that part of the brain through that. I guess our main thing that we're always trying to focus on is making people better survivors with this in mind, with knowing that if we can make the person in front of us as neuroplastic or as metaplastic as possible, then we can see change. And my father-in-law suffered from a stroke recently. He was unable to reach the phone to dial 911 in the UK. He's living. And basically, he stayed 17 hours just trying to get to the phone to dial 911. And when he finally did, they had to break down the door. He was unconscious, and basically it was a very severe stroke that he had. 3 months later, he's walking as if nothing happened. And I'm not saying it's all down to what we were doing with him, but the sort of things that we started doing with him was a lot of sensory input right from the get-go. And the physio, at NHS, it was once a week, twice a week. We were doing all the time on the phone, through Zoom, just lots and lots of visual stimulation, vestibular stimulation, whatever he can do. Lots of graded motor imagery, mirror box therapy, but it was a very intense kind of rehab through Zoom. And my husband obviously went there, but he wasn't allowed in because it was COVID. So he was just every day giving the nurse different makeup brushes, different tactile stimulations, and also his mindset was everything. He's a very determined individual, and although was told it would be very difficult for him to regain full function of his right side, is now here in Dubai living with us, very just taking care of our toddler without us. We're at work, so he's fully functioning. And thank you for allowing me to be here.
My name is Marwan Abdulaziz. I am the Managing Director of Dubai Science Park. I'll be moderating the session, so if I could ask the speakers to come on stage, please, starting with you, Hiba, Dr. Nils, and Mohammed. Very interesting topic for sure. Dr. Nils, if I may start with you. What is research telling us about the future of treating paralysis?
Yeah, I think we have a lot of developments nowadays and options for the future for paralyzed patients. My topic today was the spinal cord, the traumatic spinal cord injury, the chronic and the subacute. I think now we have the tools to treat this kind of patients, for instance, with autologous stem cells, to make a repair in the spinal cord injury area with the stem cells. This we know already from the clinical trials. It's working very well in the subacute stage. So even a complete paralyzed patient has a chance for improvement. To coming back with motor function, sensory function, bladder and bowel function. This we have, and of course we have a lot of other kind of diseases and facing with paralysis involving the motor function. Yeah. There are degenerative diseases, and in this kind of diseases, normally we can going for minimal invasive surgery. Nowadays, we are using in the operating theater all the high techs, what you can imagine. We have the neuromonitoring to make the surgery safe. We have the interoperative navigation and interoperative 3D imaging. Just in case if we have to make fixation and stabilization, so we can implant screws with a very high application accuracy, less than 1 millimeter. Now we are able, and even we have nowadays for brain injury, the intraoperative MRI or for tumors. And now I think you know this even, we are starting with robotic surgery in all the fields. And on the other hand, of course, we need medications, for instance, for non-inflammatory diseases like multiple sclerosis. Yeah. So there's a huge development in this field. On the other hand, we have the genetic engineering. It's very promising.
Yes,
yeah,
yes, yes.
And
so it is both on the diagnostic side and also on the treatment side. So you have development more and more in the diagnosis, and also the treatment is getting better and better.
Of
and
course,
more personalized, I think.
Now the focus is more on the treatment, because the diagnostic tools we have already. Yeah, we have CT, we have MRI, we have functional MRI, we have PET scan to see the function of the brain and of the spinal cord. We can make fiber tracking. So now we are focusing for the treatment of the patient. Yeah.
Okay.
For a better quality of life.
Right, very good. Now, Hiba, if I look at you, and if we, look at the non-medical world, because there is obviously a lot happening there as well. Is the sport, the science in sport getting more, let's say, verified in a way, and proven that it can do more than just prevention?
Yeah, definitely. I think all the stuff that we're doing now in the health and fitness world is old news for those who've been doing, working with teams, and applied neuroscience in particular has been really a big focus. Vision training has been a big focus in improving athletic performance. And now, only now, it's actually really starting to enter more of the fitness and health side of things. And our realization how important active rehab is, because although the physiotherapist is also doing active rehab, I think as movement professionals, to understand just how much of an impact movement alone has is hugely important, and as I mentioned, a big responsibility. So it's definitely becoming a lot more emphasized in certification courses.
Yeah. Usually in medicine, there is someone who pays for it, right?
Yeah.
So you know exactly you can spend X amount of money, and you can have it then sort of reimbursed through the sale of medicine or equipment or whatever. But that's not really the case with movement and sports. Professional sports is different, but again, it has a similar ecosystem, but not your general fitness, if you will.
We're very careful to not make any bold claims and not say this is going to fix you or be the be-all, end-all. We are very much emphasizing the language the instructors use when they're doing all these things, to be very much do no harm, first and foremost, and then do what you can to help and work with the medical practitioner rather than just try stuff randomly. So it's all based on assessment, and as I mentioned, nothing that isn't evidence-based, or no bold claims are made. So then that way it becomes a little bit more like trying to make you a better mover. We're trying to make your eyes function better. We're trying to, let's see what happens, how your autonomic nervous system is responding to that at an individual level, without saying this is the thing that you should be doing for sure.
Yeah, no, I understand. Dr. Mohammed, if I look at the medical technologies and the equipment, how much of a role are they playing in paralysis?
This is really a wide spectrum question, which is really important. As a health or as a part of a healthcare sector provider, we have been supplying all the latest technology across UAE or the region even. So we are providing the latest technology, specifically as Arjo, in rehabilitation. So this really improved the clinical outcomes and reduced the cost in both patient and healthcare facility. In addition to that, which is, I think, Zainab mentioned, awareness. we have found that as a healthcare sector rule, we should also address the awareness. How? By creating a clinical consultancy program, which I have mentioned in my presentation. This really helps both patient and healthcare provider. Indeed, handling a patient is a responsibility of healthcare provider. But today, I am a nurse or a physiotherapy. Handling a patient, I got a back pain. So I am the next patient. So educating both healthcare provider and nurse. In addition to that, patient, to address his problem, the plan, how to avoid, I can say, causes and reasons, and what's the best treatment. So this is, I think, the conclusion about our rule as from industrial perspective.
Right. Okay. It was very good hearing from all of you, and we'll definitely keep you engaged in the future events. Thank you very much.
Thank you.